New at 5, Kansas City is fighting the opioid epidemic and hoping to prevent more people from getting addicted or dying. The CDC has been tracking opioid deaths for decades. This graph that you're looking at shows the number of overdose deaths from 2000 to 2015. You can see how much they've skyrocketed. Our Ashley Arnold spoke with local officials who got together to try and come up with a solution. Ashley?
Yeah, Brad, you know, hospitals in the metro and across the country have been seeing this rise in people abusing opioids. Here in Missouri, between 2015 and 2016, we have seen a 35% increase in opioid overdoses, something that one man that we sat down and spoke to says he knows all too well.
For me, overdoses, that wasn't enough to stop me. Ruining relationships with girlfriends, that wasn't enough to stop me. Being physically sick, that wasn't enough to stop me.
And for a decade, the cycle would continue on for Kyle Winslow. For 3.5 months, he's been in recovery. He started down the perilous road to addiction after an ankle injury as a freshman in high school. Years later, he was introduced to heroin.
After that, it just got so bad. It was like a job, waking up every morning and trying to figure out how I'm going to get my next high.
So the financial impacts just kind of keep expanding as
Today, representatives from health departments, nonprofits, police, and hospitals discuss the opioid epidemic and how to tackle the growing problem.
It's more than just two prongs. There is the piece that is prevention, which ideally would be the best way to approach this, but we do have a problem and a crisis with those that have a problem. And so we need to help fix that and also work with those people so that we don't have relapses and continuation of the same problem.
Still, solutions are hard to come by, but experts have an eye on what will work.
What are those things that we can do to change, augment, improve the chronic pain problem and not just focus on diversion and addiction, but rather focus on the physiology and how can we change that? And in fact, that's what's going on right now.
Now, some of the other topics that were discussed today also talk about how we handle this problem before it starts, as talking about the prescription drug monitoring program, and then also discussing what we do after this when people are doing recovery. That's getting sober houses that are put in place, as well as resources so people can get back on track. Live in Kansas City, Ashley Arnold, KCTV 5 News.